This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
Good morning. Today we're going to talk about angioedema. So we see folks who have anaphylaxis, right? And anaphylaxis is a histamine-mediated pathway. And so what are meds, generally speaking, for someone who has anaphylaxis? So Epi's one. So why do we give both Benadryl and famotidine? It's specifically because they work at two different histamine receptors, right? So H1, H2, right? So you have you're hitting all of your histamine areas. So your H1, H2, cell-mediated also decreases that response. Then epinephrine is vasoconstrictor, but also has downstream effects in terms of that histamine release, right? And then that leakiness decreases as a result. So when you have an ACE inhibitor and you have angioedema as a result of that, are those medications going to work? No. And what's the reason, though? Key is that ACE inhibitor angioedema is not a result of a histamine pathway, right? It's a result of a bradykinin pathway. So ACE inhibitors inhibit ACE, right, which is your bradykinin pathway. And so as a result, these patients will not be responsive, generally speaking, to Epi, cell-mediated, Benadryl, and famotidine. And so we have to think about other things. So the biggest risk we have with ACE-induced angioedema is airway, right? So that's the thing we worry about, right? You see these people, they have their lips swell, face swells, tongue swells, and then as a result, they have impending airway disaster, right? And so there's different levels in terms of how folks show up. So folks can show up with just lips. Some can just show up with just half of the tongue, full tongue, right? But each one of these can be really dangerous because the progression is important. So if you have someone who's been progressing over like a day and a half, who only has lips, I probably feel a little bit better about them unless they took their ACE inhibitor again. But a person who's like, you know what, I woke up this morning, I was fine, all of a sudden my lips and my tongue is starting to swell, I'm really nervous about that person. And so our management for these folks is three things. First, airway assessment. If they are having impending airway issues, these folks need to be intubated, right? We got to get their airway because you don't want to end up with a crash crike. And so a lot of times with these folks, if we're worried about this in the oropharynx, posterior oropharynx, we'll do a awake nasal intubation. The one thing I want you guys to all remember is that we have LMX in the Pyxis, and LMX is a 5% lidocaine that is water-soluble, so you can just put it on the back of the tongue and it dissolves, and then will give really good anesthesia to the throat. So if we're doing an awake intubation, just like go pull some LMX. Don't even ask, because we'll use it. But then there's other things that we can do if these folks aren't an impending airway disaster and we feel like we need to intubate them. And that is two different meds. So the one that's the go-to that we have is Icatibant. Icatibant, these are bradykinin antagonists. So they actually go and offset what the ACE inhibitor does by going and actually antagonizing that bradykinin, so that receptor, so that way it doesn't continue to induce and actually can decrease that swelling and actually come to resolution in a quicker time. The other that is on the list that's had some data is FFP, but generally speaking, if we are going to give a medication, it's going to be Icatibant. So just remember Icatibant in your head. The big takeaway points are that angioedema, ACE inhibitor-induced angioedema is different than anaphylaxis, right? And we're not going to use those meds that we normally use. Some people might still order it, but in your mind, just be like, well, I'm going to give this, but it's going to do nothing. But then the go-to is Icatibant or intubation. And the last thing is that if this person comes in and they end up being able to go home, what's the one thing that you should be telling these people before they leave? That the doc probably already did, or APP probably did, is what? Exactly. So discontinuing of ACE inhibitor is also treatment for this, right? Because you don't want them to have this happen to them again. So let's have a good day.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.